Aging is a process. You can't escape it. Anti-aging is a big buzzword. Everybody's trying to do anti-aging. I want to be very clear. Plastic surgery is not anti-aging. I cannot reverse the nature of your tissues. I can reshape them. I can reposition them. I can make them look better. But the nature of it, the way it's built, it's still that same age.
Today, we're going beyond aesthetics. This is about autonomy, power, and informed choice. I want to introduce you guys to Dr. Jugenburg. He is a trusted voice in modern plastic surgery. I'm so excited to have this guy on. The real Dr. Six on IG. I'll share his credentials with you all in the show notes. And he's a pioneer in women's health. He's the founder of, listen to this, the Toronto Cosmetic Surgery Institute, and he's widely respected for his ethics and innovation. If you're 40 plus and you're deeply invested in how you feel, how you perform, and how you show up in the world, this conversation is for you, and we're going to keep it real. So welcome to the show. I'm so excited to have you on board.
Thank you. Thanks for having me.
Let's talk about the evolution of surgery for the high-achieving woman. This is often a taboo subject. We're whispering about it in the back corners. There's a lot of judgment around it. I want to hear from you, in your experience talking with women, how has the industry shifted, less about anti-aging and more about pro-agency and natural enhancement?
So things have changed. The biggest change is that it's no longer such a taboo subject. People are not so ashamed of talking about it. It's a little more in the open. This started in the early 2000s. Things changed. Before then, people would just hide it. Nobody would ever admit to having plastic surgery. And now it's come to the point where people actually show it off. You still have the sort of like the group that kind of tries to be very subtle. There's the very subtle, very natural plastic surgery, and there are people out there that I paid for it. I might as well show it off. So there's sort of two different approaches. I do a lot of breast augmentations, for example. In the sort of the field of breast augmentation, you can go for a very natural teardrop type of a look, or for the real full bubbly push-up kind of look. I call it a power boost. Kind of gives you the boost in the cleavage. A lot of women want that, and it may come as a shock to a lot of people. But quite a few women say, you know what, I've paid for it. I want to show it off. I don't want to be subtle about it.
Do you find a difference at all in women that are older versus younger, women that are, running a business, they're C-suite executives? I mean, in terms of what they're looking for.
So yes, younger women are a little more about showing it off. Older women, more professional people, they're more about subtle changes. They want to feel good in their own skin. There's all this misconception that people that want plastic surgery have self-esteem issues, have mental health issues. Not at all. Your typical professional young woman, there's just something that she wants to make a little bit better, just to feel better in her own skin. One of my patients, an athlete, someone who scales Mount Everest kind of thing. She said, I just want to feel self-confident when I walk down the beach. It's not because I'm trying to show off. I want to feel good when I put on a bikini. And sort of that's the thing. People want to feel great in their bodies. And I think that's something that I think you see in your clients, in your population. People try to be healthy because they want to feel good in their body. They want to feel healthy, and they want to feel confident in the way they look and how they feel and how their health is. And this is about feeling great in your own body.
Yeah, it's a shift away from trying to fit, look like somebody else, but really, with the people, my audience, these are women that are really investing in themselves, whether that's through career counseling, they're joining mastermind groups, they're learning how to train at the gym, they're building muscle, they're really trying to optimize as much as possible. They're changing how they're feeding themselves. They're conscious of their bone health and all of that. And it's really more a move towards being proactive around the aging process and trying to enhance their own kind of natural beauty. It's that confidence and that harmony with, how they're feeling inside, and they're refining versus completely reinventing, right? They don't want to look like somebody else. I don't want to look like, some supermodel. I want to look like myself the best I could possibly be.
Absolutely. It's the women that spend millions of dollars looking like a Barbie to make the headlines. But your real plastic surgery patient is a woman who just wants to be the better version of herself, more confident in her own body. Like your patients, they spend all this time and effort to be healthy. They work out, they build muscle, they tone the muscles, they burn fat, they get beautiful physiques. But there's certain things that just no amount of diet and exercise can help. And that's where I come in and I'm able to help with the final step that just, that you just can't do on your own. There's some things that no amount of willpower can do.
Yeah, there's a lot of, I know the semaglutide world is awry with a lot of judgment, right? Like, people should just white knuckle it through the diet process. And my husband and I were discussing, for people that have a lot of food noise that can lead to emotional eating, binge eating, and that sort of thing, it can be a very, very powerful lever to be able to pull. And it's true, there's some things that, if I think of, in my family, the women genetically have a lot of eyelid skin. And I
Yeah.
had my first eyelid surgery, just the upper lid, but I had that done when I was 36, and it made the world of difference. It was very subtle. No one noticed. Very discreet, very subtle, but it was incredible. And I thought, gosh, this is incredible. What's possible these days? And my mother, everyone knows my mother, but one of my enticement for her, which she didn't take up until 2 years later, but one of my enticements for her to join my transformation program, I said, if you can lose 30 pounds, I'm going to pay for your bluroplasty, and because she was 70 and she could barely open her eyes. She
A great
barely opened them. There was just so much excessive skin.
It's
Yeah.
a great example. So excess skin is something that doesn't go away with diet and exercise. As you age, you lose elasticity in your skin stretches out, you get saggy skin. There's no magic. There's no exercise that you can do. You simply have to trim it off. There's only surgery that can help. And in a situation like this, you don't make it subtle. You want to look refreshed. You want to look like you're more awake, not wide open eyes like, oh my God, what did you get done? It's subtle. You look beautiful. You look like yourself, less tired, less exhausted, more alive.
Yeah. Yeah. I think a myth worth dismantling is that surgery is about vanity versus surgery is self-respect, right? And it really has to die.
It takes a lot of courage for women to come in and get surgery. It's scary. People are scared. It actually takes a lot of courage, a lot of time for them to sort of cross the threshold. There's the fear of the surgery, fear of pain and recovery, but there's also, unfortunately, this shame. People feel like, oh, I'm like kind of like cheating. You're not cheating. We're here to help you. We're not trying to fast track or skip some steps. You've done all the hard work. You've done your part. Now we come in and we can help you with what we can help with.
Do you just, probably this is an obvious answer, but do you only work with women or do you work with men as well?
We have men as well. In our practice, men represent about 5% of our patients. In some practice, could be go up to 15, 20. But women are mostly the people that are interested in cosmetic surgery, plastic procedures. Men, it's a little more limited. Men would get a facelift. Men would get gynecomastia, which is male breast reduction, tummy tucks, maybe liposuction. Those are the more common procedures in men. Women, the whole gamut of it. We do it all.
I feel like I see a lot more men, especially in the bodybuilding world, being very open. I think Sebum was probably the most open about getting hair.
Hair restoration.
Yeah.
Yep. Yeah, we do quite a lot of that. So that I didn't mention, but yeah, it's probably one of the more common procedures for men. So as women are more concerned about their body, men tend to be concerned about their head and their hair. Yes.
Interesting. Yeah, and it makes an incredible difference when you see those hairlines change. It's like fascinating. Dr. J, what is the most self-honoring reason you've heard from a woman, 45 plus pursuing a procedure?
Pretty much every patient is just so grateful for what we can do for them. I don't know if you watch me on social media, but just yesterday, I reposted a video. It was actually a younger woman, she's in her 20s, who was crying because she's never felt comfortable wearing a bikini. We did a tummy tuck for her with some liposuction, and she just posted a picture of herself in a bikini and started crying. Just this is the positive impact we make on people. We make people happy. Uh, I spoke to some other healthcare professional about this, and I said, I work with happiness. I'm not curing cancer. I make people happy. And if you're not happy, sometimes life's just not worth living. So we try to make quality of life better. We are quality of life happiness type of procedures.
I love that. That's a great byline. I make people happy. We're kind of in similar businesses, but I'm on the slower road.
We
Um,
do it
and
quickly, true, but it's not a, it's people sometimes think it's because it's quick, it's a little bit of cheating. It's not cheating.
no,
There goes a lot into this. Um, there goes a lot of work, and people need to understand that what I do is just a part of it. The best results come when the doctor and patient form a partnership. I do my part, and you do your part in recovery and maintaining what we give you. Because once I do a tummy tuck or liposuction or a facelift, you're not frozen in time. You're not a marble statue like sculpted and that's going to be like this forever. You have to work hard to maintain it because if you don't, it's all going to fall apart.
yeah. And on that note, I know that emotional resilience, decision making power is pretty huge for you. And I think, we were talking earlier, you had mentioned that for some people, you recommend that they're not a candidate for surgery. So I'd love to talk about that a little bit with the listeners. In this phase of life, we like to think we know who we are, but judgment can still really linger, and especially around choosing surgery. So, let's talk about emotional readiness. I know that you screen for motivation and mental state and grounded expectations. So it'd be great, maybe if you would talk about like what an ideal, like how would somebody, what would you recommend to somebody if they're interested in this, whether it's the eyelids or whether it's the jawline or whether it's a face, whatever, right? Like how would you get them to be in the right frame for this?
So the screening we go through is sort of a stepwise screening process. First, we want to make sure that you're medically healthy. So we do a medical screen, medical questionnaire. We want to make sure that you're mentally ready, you're in the right frame of mind. And then comes the big one. The big one is realistic expectations. And that's really, really difficult these days with social media. Nobody posts stuff. Everybody's filtering results. Everybody's just posting the best version of themselves. So people see these perfect bodies now. Now AI is getting into it. It's going to be really a big problem. And they're seeing these things and they're thinking, oh, that's normal. I can look like this. And so for me, the biggest challenge in my practice is explain to my patients what is and what is not realistic, what I can and cannot create for them. People don't realize it, but I'm not a magician. I'm a plastic surgeon. I got to work with your anatomy, with your body, and I can't create something out of nothing. We got to work with your existing anatomy. That's the biggest thing. And again, going to expectations. Unfortunately, with social media, uh, even people that post about their surgeries, they still filter their pictures.
They're filtering. Yeah.
Even if they're being honest about their surgery, what they're putting out there is the best version of themselves. People still filter things. So even though you show me a picture of a woman that had a, let's say a BBL, Brazilian butt lift, or a facelift, whatever else, yeah, but that's not how you're going to look. That's filters, that's makeup, that's lighting. In real life, results are not as great. Recently, a couple of celebrities, I don't want to mention any names, posted results, and everybody was going crazy, like, "Oh my God, who's a surgeon? I want to know." Well, the answer is it's a filter, so no surgeon can really do that. Like they look great, they had a beautiful work done, but those filters they just push you just that tiny little difference that, as a plastic surgeon, I see make all the difference, and that is just unrealistic. That one last little step is just so difficult to achieve.
Yeah, it's that navigating, enhancement, right? We want to enhance what's naturally there versus, and we can all see it, that we're hurdling. I think we've been hurdling since, the Kardashians came to that celebrity status. We've become so normalized to filters and to excessive amounts of makeup, and it's a real problem, especially for the younger people. But for the women who are listening to this, really being like really doing the work, whether it's researching, whether it's talking to other women who have gone through it. I know one of my clients is interviewing several doctors and really taking her time and not being reactive. Like, okay, I'm going to cut my bangs today, right? Like really being thoughtful, and making sure that it's the best decision, it's a healthy decision, and that they've got clear and guided expectations for the outcomes. It's so important.
If I can give one piece of advice to your
Yeah.
viewers, your followers, if you're thinking about cosmetic plastic surgery and you're sort of doing your research, trying to find some inspiration, Please don't go on social media. Don't look at models. Don't look at influencers. Go on plastic surgery websites, which have standardized before and after pictures, nude pictures or minimal coverage bikini pictures, where you have the standardized lighting and position before and after. Hopefully, that a respectable plastic surgeon or the site hasn't altered their pictures. You've seen the real results, and then try to find somebody who looks like you in the before picture. That'll give you an idea of what someone with your anatomy, your body can expect. Because if you're a short person with really wide hips, I'll never be able to give you the tiny waist that somebody else may have that's tall, lanky, and super narrow.
Structure, yeah.
Two different structures, different skeletal structure, different fat distribution, uh, two different people. It's just not possible. So try to find someone who looks like you in the before to get an idea of what we can do for you in the after.
I love that. Okay, so just to reiterate that for people that are listening, instead of going to social media, I mean, you might find somebody on social media, but then what you really need to do is go find that surgeon on a plastic surgery website. Is there a specific site to go to?
So each surgeon has their website with their before and after gallery. So you can go on plastic surgery websites. There are some sites which are like sort of cover a lot of. There's one called realself.com, which has surgeons from around the world, thousands of pictures, great resource. And look at their galleries. And the idea is you want to find pictures where the before and after in the same position, same lighting, same shadow, because posing makes such a big difference. I see this so much, and it's like one of my little pet peeves when surgeons pose before and after. They show the sterile kind of before picture that they take in the OR or in their office when a patient's standing, and then they send it next to it as the after is a patient selfie where she's twisted, smiling, filtered, completely different position. It's not a good, fair assessment of the before and after. You really don't know what happened. So you really want to have standardized photos. It's so important. Same pose, same light, same shadow, before and after. Very important.
Very important. I love that. Let's talk a little bit about surgical interventions through the longevity lens, because this is dear to my heart, right? When I think of how I want to be when I'm 90, I want to make sure that I'm doing all the things preemptively that I can do, and then also being very timely with any other larger interventions. And that I'm sure a lot of listeners are, they're with me, because I know when I'm on socials, I'll see some of my clients, I'll see their names on the same, doctor sites. I'm like, oh, she's looking at that too. So, like my clients and most of the gals listening to this show, they train hard. They're eating intentionally. They're doing everything to optimize muscle growth, bone density, all of that, hormonal health. How does surgical strategy fit into this performance forward life?
So when I work with athletes or people who have gone through weight loss journeys, the issues we're facing is skin laxity. Skin laxity is just something that no amount of diet or exercise can really help with. And this is where surgery comes in. So you need to understand that if you have loose skin, you're going to be trading loose skin for scars. There's no magic. People are always asking for non-surgical skin tightening procedures. There's millions out there, and if they worked, I would be out of business. That tells you how well
Okay,
they
say
work.
that again. There are a million non-surgical skin tightening
Procedures,
procedures.
and if they really worked, I
You'd
would.
be out of business. Do they work a little bit? A little bit, not statistically significant.
A little bit, right? So there are some little treatments for the face where a millimeter makes a difference. But if you try to do the same thing on your tummy where you have lots of hanging skin, you're not going to notice much of a difference. So we do offer some treatments to our patients. This is usually ideal for somebody who's got really minimal skin laxity. For example, if I'm doing liposuction, I add a treatment called Rejuvenate Plasma, which just kind of tightens things a little bit. It is not a replacement for a tummy tuck. If someone needs a tummy tuck, nothing is going to replace a tummy tuck. And tummy tuck is ideal for somebody who's got a lot of loose skin. And if you're wondering, am I one of those people? The best thing you can do is sit down. So you're sitting, sort of in a 90-degree flexion at your hips, grab your belly skin. If you can grab your skin and pull it down, you have enough skin for a tummy tuck. If you're struggling to pinch your skin, then you don't need a tummy tuck. You can't get a tummy tuck. And that's I'll go off on a little tangent. We sometimes see women who want not necessarily tummy tuck, they want an arm lift or a thigh lift, and they're in a really, really good shape. Um, So there'd be an example of somebody I would turn away. Like you really need to have excess amount of skin because you are treating the skin for scars, and sometimes having the scar is just not worth it. Sometimes it's better to have a little bit of skin laxity. So don't be so hard on yourself. Accept a little imperfection. Sometimes surgery is not the best option. Sometimes doing nothing may be the best option.
Yeah, I remember you saying that on our call earlier. You know, you're replacing loose skin with a scar. Same thing with a breast lift, right? Like, do you need a breast lift? Knowing that you will have that scar. And that's something to really get the head wrapped around, because otherwise you're living with a choice that you weren't really fully aware what exactly you were making.
Exactly. And if you think of a breast lift, look at a breast lift scars. So go on a plastic surgery website, look at the scars. So if you go for consultations with a plastic surgeon, ask them to show you not one, but a lot of scars. You don't want to see the one best scenario. You want to see a lot of breast lift scars to get an idea of what the scar is going to look like and what this surgeon is able to create for you.
So that being said, are there things like, I'm going to ask some questions that my clients have wanted me to ask you. So, say a gal has had a lot of filler done, and she wants to be best prepared for surgery. Would you recommend that she dissolve her filler? Would you recommend that she do any procedures to help amplify the quality of her skin? Like, is readiness something she should be doing? Any kind of needling, whatever. So I'd like you to talk about, like, what could somebody do if she was really thinking about preparing for that kind of a surgery, to give her the best outcome.
The only thing I would recommend is try to dissolve your fillers, but that's actually difficult. Filler spreads a little bit. It's difficult to get the digestive enzyme that dissolves fillers just in the right place. So do your best, see if you can dissolve it, but if you can't, maybe give it some time so it dissolves on its own, but don't do anything else. Don't do radius, don't do any skin rejuvenation, nothing that. Just let it be. Pure, untouched virgin skin is the best skin for a facelift.
Interesting. All right. So if you can dissolve the fillers, do it. Don't stress about it. Definitely don't get more fillers put in. Is that
Correct.
because it complicates things as you're
It
working?
does. So well, there's the legal fillers and the illegal fillers. Illegal fillers would be things that are permanent, like silicone. People used to inject silicone or all kinds of different things. Those are horrible. The legal fillers, most commonly are called hyaluronic acid, HA fillers, and these work by sucking in water. So you inject this molecule called hyaluronic acid, and it absorbs water, and the water kind of swells things up, gives you volume, which is great for filler purposes. The problem is when you do surgery and you operate through these water swollen areas, if you're trying to put some stitches into it to put traction, you're trying to pull on the skin, attract something, you're putting sutures into water. It's not holding, it's going to rip through. So it's difficult to get a good traction and pulling up the skin.
Well said. All right. And then in terms of, what are best practices that a woman can do, if she's, sort of taking a more minimal approach, right? So let's say, and then I'm going to ask you what's worth it and what's not worth it. So, for example, say you've got a 35-year-old and she decides, like I did, I'm going to get my eyelids done or whatnot, but I also can see that my skin's starting to get a little bit lax. What are some things that she could do in terms of enhancing her skin? Can you talk about that at all? And what's not worth it? Like, what is it, that needling that they put in and pull? Is that worth it? Is it not worth it?
Don't even get me started. But let me start by saying the best, the most effective, and the cheapest anti-aging process treatment you can ever do is don't smoke and wear sunscreen. Smoking and UV radiation are by far the worst things you can do for your skin, and it's so easily demonstrable. UV radiation creates wrinkles, degrades the elasticity of your skin, uh, obviously skin cancer. But that's the quality of a smoker who's been out in the sun. Their skin is just absolutely horrible. So those are the simple things. Now, this would be advice from early on. This is the advice I give my younger patients and my girls who are teenagers: away from the sun, and don't ever smoke. As you get older, what can you do? So again, you want to protect yourself from the sun, so avoid UV radiation, sunscreen when you can, or hat, protect yourself. Next thing is moisturizer. Vitamin C is great. Topical vitamin C or vitamin E supplements. These are great things that are pretty cheap and are very, very good for your skin.
You didn't mention retinol or any of the other.
Okay, so retinol is vitamin A. That's great too as well.
Okay.
So retinol creams, yes.
All right. That sounds pretty simple. So everything else, I saw you didn't mention it, so that's taboo.
So you mentioned threads. I'm not a big fan of threads. When I was a resident, when I was training to be a plastic surgeon, I remember my teachers telling me about threads, the old threads, how horrible they were. And so I never had the desire to even try them. And they kind of made a comeback. And it's unfortunate. 20 years later, people kind of forget about all the bad things. Now they make a comeback. So you have all these threads. And I have not heard any good stories about them. They either don't work, leave people with complications, or kind of fail after 2 3 months, which is you would expect. So if you're happy spending money on a treatment that lasts 3 months, go ahead. The downside though is that every time you put a thread in, it's going to create a little bit of scar tissue, and you're going to create a lot of scar tissue if you keep doing this. So that one day when you come back and you need a facelift, the scar tissue is going to prevent easy mobility of your tissues, can potentially create scar tissue that kind of creates contraction between the scar and facial nerve, which is very dangerous, so can cause more complications. So, yeah, I'm not a fan of threads at all, not at all.
Yeah. Okay. Thanks for covering that. I know. I've seen other plastic surgeons talk about that, and they're definitely not enthusiastic about it. It's like a stopgap, and it's not that effective.
You'll notice people that do threads are people that are not able to operate. So they're limited in what they can do. That's all they can do. So that's what they push, unfortunately.
Okay. Let's talk about some other hot topics. What about things like cellulite? Is there anything that you can offer surgically for that?
If I had a solution to a cellulite, I'd be a billionaire. There's a few treatments out there that seem to be promising. Um, there was one a while ago that sort of helps to sort of break the adhesion. So, what is cellulite? Cellulite is not lack of fat. It is when you have skin and there's little ligaments that are holding the skin down and pulling people down. So the treatment is to go and cut that little ligament, the skin can pop out. The problem is when you cut that little ligament, it's a cut, it's a surgical cut. And how do cuts heal? By scars. So scar again forms and pulls it down. So there's treatments that can make things a little bit better. But if you have cellulite, just accept it that you could have treatments, they could make things better, but they'll never go away. There's no perfect cure for cellulite.
Right. So you're looking at maybe augmenting it, maybe not, and then how significant is the result versus what you have to go through.
You could be a little bit better for a little bit, but eventually cellulite just comes back.
So no big breakthroughs with that yet, right?
Unfortunately, I'm still working on it, but I have yet to invent it.
So let's talk about skin laxity. What about skin laxity around the glutes or like the knees, elbows? These sorts of places. Are those operable or not?
Unfortunately, no. Two reasons. One, you could technically. The problem is those are really, really bad places to put scars because when you put a scar in an area that's mobile and the scar is, as it's healing, it's going to be a very, very ugly scar. Second thing is, unfortunately, you do need the skin excess to allow you to bend the elbow to bend. Because if you tighten up the skin, and then you won't be able to bend your elbow, and if you bend it, you'll rip it and stretch it out again. So that's sort of an anatomical problem that we can't cure yet.
Yeah, and it's also like all of this is taking place against that backdrop of age, and again, it's are we enhancing something, or are we trying to, you know,
We're trying to turn back time. And what happens when you were 18, when you were a little baby, you have a lot of elasticity. You could bend your elbow, you straighten your elbow, and the skin would stretch like a elastic band. As you age, your elastin fibers, molecules that provide us, unfortunately age as well. And surgery does not regenerate that. Maybe in the future, with some sort of stem cell therapy, some sort of true molecular regeneration, we'll be able to induce our cells to rebuild more youthful elastin. But until that happens, there's no real treatment for that.
it's another important thing to remember when we're trying to modify our expectations and being, I feel like realistic is such a buzzkill, but we want to go into this knowing, like I love getting older. I can't wait till my hair goes, totally silver. I'm excited about it. If, like I said, for a lot of women, if there's things that they can do that, have a good, I'm going to say ROI on them, it's worth it. But we're not getting into that narrative of I'm afraid to age. I'm trying to get back to being 18 again, because now we're being incredibly vulnerable, and when we're invulnerable, we're going to end up doing things with getting grifted, working with charlatans, and ultimately, it's a very bankrupt journey.
Aging is a process, you can't escape it. Anti-aging is a big buzzword. Everybody's trying to do anti-aging. I want to be very clear. Plastic surgery is not anti-aging. I cannot reverse the nature of your tissues. I can reshape them, I can reposition them, I can make them look better. But the nature of it, the way it's built, it's still that same age. So if I do a facelift for somebody, I can make them look better, but their skin is still going to be same elasticity as it was before. It will not be, it may look better, but inside of it, it's still an older person, not an 18-year-old person.
Yeah, so being able to modify those expectations and really doing that mental work of being in love with your age and who you are as a person, super important. I'd like to, the last question I'd like to dive into is more about people that are in fitness, and what would be, do's and don'ts. How can they prepare best for surgery? I know, to be transparent, one of the things I'll say to my clients, oftentimes they'll say, "Oh, I'm really thinking about having a breast lift or a tummy tuck," and what I'll recommend that they do is let's pursue, with what we're doing until we get to maintenance, right? So you see the curve, the rate of loss is sort of like goes from this to sort of flatlining, and then it's like, all right, this is maintenance. Let's reverse diet. Let's get you on some good calories, and allow. And now this might be my fantasy, Dr. Martin, but I'm like, let's get that subcutaneous matrix kind of stabilized to this new size that you are. Let's see if there's some tightening that happens naturally, maybe in 2 or 3 months, and then that would be a great time to go and pursue surgery. Don't get it right away. And plus, I'm also thinking of any possible rebound effects where, they're not able to train for a month or 2 months. And I worry about the psychology of that because, of course, training and having a routine releases endorphins, supports you mentally. And there's a negative effect mentally, for some people at least, of getting surgery and recovering from it.
So make sure I understand clearly. So you're referring to patients who are losing weight or clients that
Patients, yes.
are, okay. So,
And
so,
gaining muscle.
yes.
We specialize in that body recomp. Yeah.
So if somebody is in the process of losing weight, my recommendation is for them to lose the weight, get to the level that is stable and achievable. You can push yourself really low, but if you bounce back, that's not worth it. So get yourself to the level where you're comfortable, you're healthy, and then you want to be there for at least 3 months. You want to make sure that you're not bouncing up and down and your body is adjusted to this new level and it's comfortable there. Um, that's sort of a weight point of view. When you're asking me how to prepare people, to be honest, this is the easy part. The more difficult part is mental. Have realistic expectations. In my business, in my practice, the biggest challenge is managing people's expectations. That is by far the most difficult thing I do in my consultations, in my preparations for surgery, and wanting to make sure that people understand what they're getting themselves into, what they can expect, what the recovery is going to be like, and that they're not disappointed. So they don't have, you know, like I tell my patients, even if I do the world's greatest surgery, if it is not what you wanted, you will not be happy. So I want to make sure that what you want and what I can deliver can match up.
Is there anything else that they should prepare for in order to have the best possible outcome? Right? So they've done the diet, they've maintained for a bit. Is there anything else that they can do?
In terms of health, you want to be nutritionally stable. When people lose a lot of weight, their protein levels may be out of balance. So we want to make sure that their protein levels are really good. Their vitamins, vitamin C, and folic acid supplementation is always very, very good. We do blood work on our patients to make sure all the different blood levels are all appropriate. Um, avoid injuries. Avoid injuries. If you're talking to somebody who is um, very vigorous athlete, make sure you don't hurt yourself while you prepare yourself for surgery.
Is there a timing for this, right? So if, say somebody wanted a facelift or like pleuroplasty, breast lift, tummy tuck, should she do it all at once, or is it better to space these surgeries out? In terms of like just the hardship on the body, because it's traumatic, right, to get the surgery done.
It is possible to combine multiple procedures. Uh, in my practice, so the limiting factor is the total amount of time. I'd like to keep my surgeries under 6 hours. If you go over 4 to 6 hours, potential risks of infections, blood clots, other problems can increase. So we want to try to keep it to a minimum. Sometimes we do longer surgeries. So let's say we have a patient traveling from across the world and they can't keep flying back and forth from New Zealand or something. So we just try to combine it. But if you're a local patient and if it is possible for you to break it up, then we try to break it up to maybe 1 or 2 stages and see what we can do for you.
I have a couple more key questions, again, just for the people that are probably going to be listening to this and that are interested. Another would be recovery time,
That's
right? I kind of joke with my joke with.
I was going to talk about recovery.
Okay, all right, dive in.
Yeah, your clients are people that work out a lot, are very physically active. So you do have to plan ahead your recovery because after surgery, you want to take it easy. You have to give your body time to recover. Now, I'm not saying stay in bed, but we don't want vigorous recovery. I don't want to raise your heart rate, blood pressure. Don't want to create any bleeding, bruising. You don't want to rip open any incisions. So you do have to plan on taking it easy, which I find can be a struggle for some people that are very health minded and can't imagine living without going to the gym. But 6 weeks is how much it takes for your body to recover to the point that it's able to withstand sort of daily activity. So for the first 6 weeks, take it easy, sort of like a leisurely office-based lifestyle. After 6 weeks is when you can go back to the gym and slowly build yourself up. So for your clients, if they're very go-getters into the gym, they need to plan when is a good time for me not to go to the gym and prepare themselves mentally. Because sometimes people get very anxious. They, I gotta get back, I gotta get back. Um, Maybe plan ahead. What can I do that's low impact, gets my heart going, but allows me to recover without damaging my surgical results?
And let's talk about some red flags too. Like what are some, when you're vetting your surgeon, what are some red flags? What credentials should be looking for? You talked about the recovery approach. Can you talk a little bit about, how would you vet your surgeon? Because this is key, right? This is a big investment. It's financially a big investment. Health-wise, it's a big investment. And outcome, it's a big investment.
This is a tough question because with social media, with advertising, anybody can make themselves look like they're super genius, have the best one procedure no one else can do. What you want to do is, basics. You want to see what is the qualification of your surgeon, what is the board certification. There's a lot of, I don't want to say fake boards, but there's boards that just require you to sort of pay a membership, and there's boards that require you to be properly examined. So in Canada, we have the Royal College of Physicians and Surgeons of Canada. So if you're certified by the Royal College, that means that's your specialty. In the States is the American Board of Medical Specialties that has different specialties. So you can be specialized in, let's say, plastic surgery or ENT or internal medicine. So these are the official specialties. So you want to look, see what is their certification, what did they train in, what did they do residency in. That being said, there's a lot of doctors that may have sort of swayed away from their area of specialty and can be very good at what they're doing. So the next step is you want to look at their reviews, you want to look at their reputation in the community, and you want to look at their before and afters. And any surgeon can show you 2 or 3 really nice results. You want to see a lot of good results. You want to see a pattern of good results. If you're on social media, you want to see them post a lot of different nice results. If you look at their reviews, look at the reviews. Now, nobody's perfect. If you see someone who's got perfect reviews, run away. That's to me a red flag. Everybody's got 1 or 2 unhappy patients for whatever reason. But look at the unhappy patients, see if there's a pattern to it, get a sense, is this somebody that I like? And then finally, you go for a consultation, get a feel. Now, it is difficult because you can get fooled so easily, and going by your gut, that's not really a good barometer of who's a good surgeon. If you can ask, do you know anybody who's gone to this surgeon? Do you know other people that have gone to this person? Do they have good results? Are they happy with the results? If they had a complication, which can happen, how was it handled? No surgeon is perfect. No procedure is foolproof. There will be complications. And if it happens, did the surgeon handle it well? Did they help the patient recover and salvage the situation? Those would be the things I'd be looking for.
Is there, for people that are active and maybe they're really busy in their careers, they don't want to, they don't want to give up they don't have a lot of downtime in their year with training, but they're interested in, like the low hanging fruit, if that makes sense, for investing in some enhancement. Is there anything that you would recommend? It really pairs well with that active lifestyle and doesn't have that big downtime.
So liposuction has minimal downtime, but liposuction may not be the ideal treatment for your clientele because your clientele, I imagine, are people who build muscle and lose weight, and that means they probably have loose skin. Liposuction does not help loose skin. If anything, it makes it worse. So for patients that have lost weight, there's really no shortcuts. You really have to realize that if I have loose skin, there's no magical treatment. It just needs to be trimmed. And if I trim it, I probably need about 6 weeks recovery before I get back to sort of strenuous physical activity.
What about, I don't think all women that are in fitness have loose skin problems, other than, the normal creping of your neck and all that sort of thing. Some do, but I'd probably say, at least in my clientele, the majority don't. So more towards, women that don't have those issues where they would need the tummy tuck. Is there any kind of surgeries that you feel have remarkable results in terms of that enhancement, but more minimal downtime?
Well, when you combine the right surgery for a patient with a good surgeon, you will have remarkable results, regardless of what the procedure is. So it's individual. Um, to get nice results, you want to have a skilled surgeon and the surgery that addresses the problem. Because if you're doing the wrong surgery, no matter how hard you work, it's not going to look good.
Great. So also probably working with the surgeon that has quite a bit of experience and the feel that you're having. I don't know if this is true or not, but the feel that you're having in their chair is not that they're trying to sell you on something.
Yeah. So if you want, find someone reputable, go for consultations and ask, listen, here I am. What would you recommend? What do you think? But that being said, personally, when people come to me, I'd like them to tell me what's bothering them. I personally don't like it when someone comes to me and says, "Doctor, here I am. I'm a blank canvas. Do whatever you'd like," because I'd like them to identify what bothers them. If I'm gonna identify something that I see but it doesn't bother them, then they should not be having surgery.
That brings me to my next question. What's one mistake you see high achieving women make when approaching surgery?
I would say that the mistake or myth is, again, with social media making things look so easy, so simple. People forget that going for surgery is a real deal. Going for a facelift is not the same thing as going for a facial. It's a real surgery with real potential risks and complications and real recovery time. It takes a while. You'll be out of commission for a while, which is what a lot of high power women don't have time for. They want to get back and busy lifestyle. You do need to plan for the fact that you will not be presentable for a while, and it'll be a while before you feel back to normal.
How long? Let's have the heart. How long? Somebody said, I want to have what is it, the deep plane?
People in facelift.
Deep plane, right? So how long is it going to be before they can go on that Zoom meeting?
2 weeks. For 2 weeks, you will wrapped up. You're not going to look presentable. After 2 weeks, you're going to look good. Now, you will know something's been done, but people who've never met you before will hopefully just not realize. 3 months is when you're like fully healed. Your scars have faded. All the swelling is gone. Everything is good. But 2 weeks for sure, you don't want to leave your home. You can do Zoom meetings with no camera.
I think 2 weeks is not a lot, not too long of a period of time. What about the breast and tummy tuck,
So
skin?
So those things you can cover up. So again, 2 weeks, plan on being home 2 weeks. After 2 weeks, you can go out. And if you're fully dressed, no one sees your bandages, your scars, and it'll take 3 months to heal. So it's always the same sort of pattern: 2 weeks recovery and then 3 months to be well healed. But for body work, because you can get dressed, yeah, you can go back to work and no one know anything. No one will know anything. You just look good.
I think the last question. This is my second last question, but it's so great to have you here, and you have such a a calm and straight up, no BS approach to all of this, which is, I love that, right? I mean, I'm all about giving options for people that are evidence-based, and allowing women to make empowered choices for themselves. The last one is going to be around breast augmentation. I think a lot of my clientele have had breast augmentation, and they've had them for now, 20 years or so. I've had a couple of gals who've had complications with getting, not an explant, but a reconstruction, right?
Okay.
Where they've had to have multiple surgeries, like which is, seems very scary. For me, it's heartbreaking as their coach because it's one surgery after another surgery. What are the expectations? What would you cancel women that maybe have had breast implants for a long time? What maybe should they be doing? How to find a great doctor. I think there's so many people doing breast surgery right now. There's probably the likelihood that people are getting surgery based on the price point versus really vetting, is that surgeon a really great surgeon? Because God forbid you have to have multiple surgeries.
Yeah. So breast augmentations and Brazilian butt lifts are probably the two that pop to my mind where people really bargain shop, and it's your body. Don't bargain shop. Groupon is not the place to look for a plastic surgeon. So the question was, what would I suggest to people that had implants for a long time? So the recommendation by the FDA is to do screening. If you have silicone breast implants, you should get screening. So either high resolution ultrasound or MRI to make sure they're not ruptured. If you have thin implants, no worries, because if you have a thin implant, if it leaks and ruptures, the saline, salt water comes out, your body absorbs it, your breast deflates, right away. So that's one of the reasons why I like saline implants. They're very, very simple. Things that you sort of mentioned, people sometimes have multiple surgeries. So what can happen with breast implants is they can develop what's called capsular contracture. Capsular contracture is when the scar around the implant solidifies, hardens, and contracts, and it becomes hard, misshapen, and can potentially become painful. If this happens, the treatment is surgery. The treatment is to go in, cut out all the scar tissue, potentially change the implant, put everything back. The problem is we don't really know what causes capsular contracture. We suspect two main causes being either blood collection, so if you bleed during surgery, there's some blood in the space that can stimulate contracture, or bacterial contamination. Now, this may come as a shock to a lot of people, but women's breasts are not sterile. There's a lot of bacteria in there. So if you think about it, you have milk ducts that come out to the nipple, and those are sort of empty ducts, so bacteria crawl in, and there's bacteria inside the breast ducts. They're not infecting the breast. It's called colonization. But sometimes this bacteria can spread out, especially in women that have cystic breasts, and can affect the capsule around the implant, cause capsular contracture. So if somebody had a capsular contracture, unfortunately, the risk of recurring a capsular contracture is higher than somebody who's never had capsular contracture. And this is when it happens that some women have multiple surgeries, and we treat them. We do it one or twice. If it keeps happening back, then I tell my patients, you know what, maybe we should take them out. Maybe your body is just reacting, and this is just not good. Take them out before it becomes a serious problem.
Interesting. Okay. And then so for women getting a screening, if their screening shows is not a problem, then they really don't need to go and get that reconstructive surgery? Or do you still recommend that they see a good doctor and have a consultation?
So ideally, you're still in touch with your original plastic surgeon who did your breast augmentation, who's screening you, sees you once in a while. If that surgeon has retired or left, maybe you can get referred to somebody else or talk to your family doctor. But in terms of what you need to do, so the old recommendation was every 10 years to have them exchanged. The current recommendation is let them be, do the screening. If the screening shows that your implants are perfectly fine, there's no need to go and have unnecessary preventative surgery. So I don't recommend to my patients that they need to come back every 10 years. You don't need to change them every 10 years. You just need to do screening to make sure they're intact. If there's a problem, then we'll change them for you. If there's no problem, just let them be.
Perfect. That actually was surprising to me. I was under the thought process that they were still saying you had to replace them every 10 years.
That's no longer true.
There you go. See, I learned something. I learned many things today. Thank you so much. I think we've covered a lot of grounds, and certainly people that are listening are going to be very interested in, number one, what options are out there for them, the costs, of course, but also the recovery time, and then really how to vet a great surgeon. And certainly, I would say that it's not just how expensive a surgeon is, but as you said, you look at their credentials, look at if you can get some word of mouth, lots of photos, lots of different types of women, different, hopefully finding someone that has a similar structure or issue that you might have had, for evidence that they can really do great work. And you didn't mention this, but one of the things I was always thought about when it comes to choosing a surgeon is and maybe it's because all great surgeons are the same here, but somebody who's has really great results with their scarring, in terms of like the stitching that they do, the meticulousness of their work.
I agree. The thing is, though, you rarely see scars. People rarely show scars, so it's difficult to see. But yeah, when you go and see a plastic surgeon and they show you the before and afters, ideally they show you the nude before and after, so you can really see the person's body and you can really see their scars because it does say a lot about the finesse of the work.
Yeah,
And
I think if you're meeting a surgeon that's proud to show you evidence of their scars, you probably found a really great surgeon.
I can do a little plug in there. We show a lot of stuff on our social media, so your folks can go and watch us on Instagram on Real Doctor Six, Real DRSIX. I do show my scars. I show my scars a lot. I'm pretty proud of my scars, so I think we're known for our scars. So thanks for bringing it up.
Yeah, you bet. And guys, do head over to the Real Doctor Six. A lot of incredible social media there, a lot of great information. Interestingly, a different version of the guy that we're listening to right now. There's the music and the editing. It's a whole other level, and you have an enormous following. Actually, you're kind of famous.
I guess I jumped on this early on, so early on it kind of blew up. But I think what helps is we are different. Your typical plastic surgery account is really sort of like kind of static before and after, and kind of boasting about how good they are and all that stuff. We try to put an educational spin on this. I try to set realistic expectations. So when I show my stuff, I always talk about what I'm doing, why am I doing it. I talk about the limitations each particular case. We actually show real surgeries now. With the community
I've
guidelines
seen
change,
them.
we've had to sort of scale back a little bit. We used to show complete surgeries, and we were very transparent. We would show anybody who would consent to social media. So every person you see on our social media has consented, has in writing, and we don't cherry pick who we show. We show anybody who agrees to participate. So you get to see real things. And I'll say I'm probably the only person on social media I know that shows his own problems. You rarely see complications on social media, and if you do, the surgeon makes it very clear it's someone else's complication that they're fixing. I have no problem saying, this is my patient, didn't work out, and I'm here fixing it and showing you how I'm fixing it. And the purpose is, again, people need to have realistic expectations. They need to know sometimes things don't work out. Sometimes we need to come back and do, a touch up or something else to finally get the result. And sometimes, I show people with what's called hypertrophic scars. I show that not everybody can get perfect scar. We do our best. I would say my scars are very nice, but some people, unfortunately, have genetic predisposition to abnormal scars. And no matter what I do, they always will have abnormal scars.
Thank you so much for everything that you've shared today, and for being so frank and so honest, not only here but on your socials. I wish we could just normalize all of this and get rid of a lot of the judgment from it, and have that not be in the way. I know, again, talking about my mother, one of the resistances she had to getting that the eyelid surgery was a combination of not thinking she was kind of worth it, and also feeling that it was a vanity surgery, even though literally she could hardly open her eyes. Also fear, like that she couldn't recover from it. And in fact, she recovered incredibly well, incredibly fast. She was so healthy. I really want to make sure that this conversation resonates with the listeners. We're not talking about chasing youth. It's really about being aligned with how you feel, look, and lead your life. It's, whether or not you ever pursue surgery, this conversation should really just be a reminder that you're allowed to shape your own evolution. How you decide to age is entirely up to you.
Absolutely. I just had a patient a couple of days ago who came for a tummy tuck. her last child was 15 years ago, and I asked her, so why did you wait for 15 years? She said, well, I spent all this time looking after my kids. Now it's time to look after myself.
I think that's going to hit home for a lot of people. Thank you so much.
Thank you for having me.
Guys, I'll share all the links so you can follow Dr. Martin Jugenburg in the show notes. And if you have any follow-up questions, please message those to us, and we'll make sure we get you an answer.
Thank you again. Thanks for having me.
Thank you so much.